looks like people sort of slowed down in filtering in. So Tom, over to you.
Great, thank you, Katie. So yeah, welcome to the webinar today, everyone. Thanks for joining. We thought it'd be useful to give you some insights as to best practice in relation to publishing on behalf of multiple sites. As we know, this can be quite complex depending on your organisation structure. So if we could move to the next slide, thank you very much. So yeah, just a few reminders as to how this webinar will work. So this is specifically for multi-site organisations. So if you're a single site, I'd recommend that you access the local support organisation assistance, which is available through the Better Security, Better Care programme. Attendees are on mute and can't be seen, but there is the Q&A function within the chat box. So Steph will be looking to answer any questions that you've got as we go along through the webinar. And alternatively, we can come onto the mic and also support you with those if it needs any further clarification. And finally, if there are any questions that we can't answer, we'll come back to you with those and provide you with an email. It might be that we need to do a bit of digging into your organisation and understand some more before we can frame your query correctly. So it might not be possible on this webinar. The webinar itself is 45 minutes long, and you will of course get access to the recording and the presentations that have been provided by myself and Katie, who will be co-presenting today. So just a quick run through what we're going to look at. So I think first thing will be completing your DSPT, so a quick tour of the product. And then Katie will be running through how you'll apply DSPT to your listed sites. So some of the detail around that. Again, what to do if those sites may not be listed. So there are some anomalies which can occur for a variety of reasons. And then finally, just highlighting the free support and benefits that are out there with completing your DSPT assessment on behalf of multi-site providers. First, we're going to have a quick poll. So it's just in relation to the upcoming deadline. So I'd really appreciate if you could answer that. That's great. I can see we've nearly got a full complement who voted there. Excellent. We'll leave it as is for now. We'll continue to move on with that. So we're going to start with the first section, which is completing the DSPT. So giving you a quick tour of that. So we're going to run through some of the key pointers here. So I think the first and important thing to note is that you need to identify your organizational data service code. Now, multi-site organizations will always have more than one organizational data service code, and typically this is an A code for the headquarters, and it'll be a V code for the sites that sit underneath it. You can sometimes get a parent organization where you'll have multiple headquarters codes with multiple sites underneath them. And again, we do also see more complex structures where there's sometimes sort of a brand, if you like, which is behind the headquarters. So again, we really will support you on a case-by-case basis with these. And I would recommend looking for your ODS codes using your postcodes or other organizational information through the portal. But again, I would also highlight that if there's a bit of complexity to it, you're more than welcome to reach out to the Better Security, Better Care funded support that's available to check that you are representing your sites in the correct way and that all bases are covered, because it can be really important, because if sites aren't covered by your submission, then in effect they might not be able to be eligible for digitising social care funding for digital social care records, or they may not be able to access proxy access online or NHS mail, some of these products that require a valid DSPT submission as a prerequisite. So your legal structure might differ to how you operate the sites, so that's something to bear in mind, and you can check that there through the ODS checker. The organizational data service codes do come from CQC registrations, so that both databases are linked. But as you can see, when your service closes or reopens, or if there's a change of that registration, the ODS code will change with it. However, there might be a lag in that ODS code being generated, bearing in mind that it's the CQC registration that comes first. So it's important to do some background work and maybe think about what might have changed in terms of how you've registered with the CQC. And if you do find that your ODS code has changed, then you will need to contact the Exeter Help Desk to get them to assign that new ODS to your profile. It is also possible for them to move any previous assessment to your new assessment, sort of provided that there aren't any sort of changes in terms of the service that you're delivering or how you've operated, because you might be operating within a sort of new policies, procedures due to an organisational change. So when you are registering and completing the DSPT, broadly there's sort of two options for you to get that done. So the first one would be to sort of register and complete one headquarters assessment and to publish that on behalf of all of your sites. So again, how to choose. So that's if all your policies, processes and procedures relating to data protection and cybersecurity are mirrored across those sites, then it's best practice to complete that assessment to cover all sites. Although we'll come on to it in a minute, but it's very much recommended that you fully inform your sites of what you've put in that assessment and sort of what their obligations are to reflect your submission in practice. And secondly, you can register and complete 2 or more HQ DSPT assessments, which would cover groups of sites which are working to the same policies and procedures. So if your sort of model of care maybe has 2 or 3 different iterations, then this would be the preferable route, and it ensures that you're getting the most out of the toolkit, mindful that it's a self-assessment and it's just, you get in what you put, you get out what you put into the toolkit. And finally, in terms of accessing that support for complex site structures, the Exeter Help Desk are the support line who will be able to enact these changes. So that's where you go to make the changes themselves. However, your local support partners will be able to provide you with some useful advice and guidance on how to configure that. So again, if you've got any queries or you just want a sense check of what you're planning on doing, it'd be recommended to get in touch with your local support partners in the first instance, and that'll save you having to go back and forth with the Exeter Help Desk, because if they don't get it in a format that they understand, then they won't be able to make the changes to your multi-site submissions. So in terms of the toolkit view, so this is just giving you a bit of information as to where you can do your organisation search. So that's the link to the toolkit itself. And again, if you've not already registered, this is where you'd register your code. I think it's just worth bearing in mind, as we sort of pointed out previously, if there has been a change of ownership, a change of ODS codes, you do want to make sure you do that transfer rather than register a new code when that information might already be saved from a previous year's submission. So again, your organisational profile. So you're putting yourself down as a social care organisation. This is really important because there's actually 4 different categories of DSPT, and they will have different questions depending on the sector that's represented by that category. So if you select another one, for instance, you might find different or many more questions that are mandatory. So this is important. And finally, this is a sort of recommendation, and appreciate if you are an extremely large multi-site organisation, this might be challenging, and there's potentially other routes around disseminating this information to your sites. However, if you are a multi-site organisation not of enormous scale, it is recommended that we would give registered managers of sites viewer access to your DSPT submission. So that will give them the opportunity to understand what arrangements are in place at their site, because it might be that they're the ones that are on the sharp end of a cyber incident, for instance, or there might be a data breach that they need to action. So useful for them to be privy to that information. And also, if there's something that they're not aware of, or they actually disagree that with some of the questions, it gives them that opportunity to healthily challenge it and to improve overall the data security and cyber security arrangements across your organisation. Appreciate, you might not want to give that sort of member or administrator access because they could fundamentally alter what you've put. So that's understandable, but that viewer access useful to give them sight of it and make sure it's a more robust submission all round. And finally, just a little bit of insight here into how the DSPT assessment is grouped. So you can see there the 4 different categories. So you've got your staffing and roles, your policies, procedures, data security, IT systems and devices. So as IT systems and devices comes in especially around standards met, and of course a lot of that will be consistent across your multi-sites, with many of these third-party services or in-house services being procured for the whole of your sort of care sites. So yeah, worth just bearing in mind that you've got 26 in that first approaching standard submission and 42 for standards met. But yeah, standards met's where sort of every provider will be in terms of that delivery after the first submission anyway, because you can't republish at standards met. Finally, an example question here. So it's giving you a bit of insight into how you might want to answer your toolkit submission. So you've got the question at the top, which is in bold, and the evidence item. I'd ignore the numbers by the evidence item. That's more in relation to the whole overall DSPT picture. Whatever's listed as sort of mandatory for you to submit, you will need to complete. But worth bearing in mind here, once you've done it once, you will potentially see the whole toolkit view. So it will change from the approaching standards to the standards met toolkit view. So you'll just need to republish with those mandatory items. So again, your local support organisation can provide any help and support with that. You've got the tool tips there as well. So again, they'll give you some useful links to support you with answering the question. And that's where you sort of write your answer just underneath there. But again, comments could be provided. So if you're looking to share that information with other colleagues within your organisation, useful to give them any sort of notes which would assist them with understanding how you've framed your toolkit answer there. So worth bearing that in mind. But also a lot of local support organisations within your region will have done demonstrations on this. So it's, again, you can access some sort of best practice guidance on how you would answer these questions. I'm going to now hand over to the one and only Katie Thorne.
Thanks, Tom. So can I just go into a little bit more detail now about how you can make sure as a head office, all of your sites I've listed as having a DSPT publication next to them. There is always an option that you could choose it. Each of your individual sites would have to complete the toolkit for themselves. Particularly, we see this in franchises sometimes where as a head office, you might not have sites of policies and procedures. We're not going to go into detail for that option today. Your individual sites would, if you chose to have them complete the toolkits themselves rather than you doing it on their behalf, can access support through local support partners, and people will be happy to do that. So kind of next bit, we're going to be assuming as a head office, you're going to be completing on behalf of all of your sites. So as Tom mentioned, when you register, you should be registering using your organization's HQ code. Once you've looked them up, if you have multiple HQ ODS codes, you'll need to register for all of those. Make sure you're using your same email address that you'll set up as an administrator. And then when you log into the toolkit, you will see a page like this, which will say all of the different organizations which are associated with you as the administrator of that. You will have to go into each of those organizations and complete the organization profile, saying that they're social care, as Tom mentioned earlier, for each of those individually. You then have two different options of how you can complete as a head office. So the first one, as Tom has mentioned already, if all of your individual locations complete exactly the same policies and procedures, have the same staff training, and you have one head office code, then you can complete one assessment which covers all of your sites, And when it comes to publishing at the end, you will get a pop-up box like the one on the right-hand side here, which says, who would you like to publish for? This is an example. It's not actually 4 seasons, I should say. It's just a demo version of the toolkit. And then you should see all of your individual sites listed there. You can go through and select the ones that you would like to publish for. Next slide. You also have the option to provide evidence for multiple organisations in one go. So say there are some similarities. So for example, you have the same training requirements and the same policies and procedures, but then there are other differences. So you've got individual ICO registrations, for example. You wouldn't be able to complete one toolkit submission to cover all sites because the answers aren't the same. However, in order to make things a little bit easier, you can bulk upload answers which are the same. In order to do that, you need to click on provide evidence for multiple organisations in one go. And that gives you that option to do the bulk updates across all of them. One thing to remember on this, though, is that you still will need to publish for each of those organisations individually. There's not a bulk publish for all options. So once you come to the end, you're sure you're ready on all of those. You'll have to go through each of the individual organisations, make sure your answers are correct, confirm all of the assertions, and then publish for those. When you are bulk answering questions, what we would recommend you do is that you make a list of which evidence items or which questions within the toolkit it is possible for you to answer across all of your sites. Once you know this, you can then select the organisations which you want to upload information for and record the correct evidence, and this will automatically populate the fields across all of those organisations. And then once you have done that, you will have to go into each organisation, as I've already mentioned, and complete any bespoke evidence items. I'm going to mention the ICO registration number again, because that's the most common one we see, which differs across multiple organisation types, and then publish for each branch. What you can do if any of your sites are not listed when you come to publish for multiple organisations. There's a couple of options Tom's mentioned already about why you might not see some of your sites automatically populating within the DSPT. Generally speaking, this happens when you either have a new location which is recently registered, or if you've recently purchased a new location and it's only just been registered with CQC. Can be up to a 6-week delay, just so you know, for that to come through from CQC registration to populating in the ODS portal. So that's the most likely reason why it's not listed. I would say don't let this delay your publication of the toolkit. You could publish with that site missing now, cover all of your other locations, and then once the ODS code comes through, have that one added on, go back in, complete for them, and then republish, and it won't impact everybody else. Just conscious that the deadline is coming up quite soon for toolkits. If a site isn't listed at all, you can contact the Exeter Help Desk either by phone or by email. They're quite used to this happening. They have experience working with multiple site organisations in social care, so they will be able to resolve that for you. Right, I'm going to hand back over then to Tom.
Great, thank you, Katie. And yeah, after giving you that context and that really useful insight from Katie there into some of the detail, we just wanted to highlight the free support and the benefits of completing your toolkit for multi-site providers. So we've got the Digital Social Care website. So that does have access to a number of different resources there. So you can see some historical videos or webinars that have been run, which will support you. You've got all the template policies and different information, such as your business continuity plan templates. And again, your local support organisation should be able to provide those for you. So yeah, there's a whole host of information, and especially I want to draw attention to that tailored support that you can get from 28 local support partners across England. that includes sort of webinars and workshops, one-to-one support, so you can go into real depth. If you are publishing, they'll be able to provide that administrative support. So yeah, a real sort of broad suite available, and would really encourage you to get in touch, sort of while this commission support is available over the next sort of few weeks while it's deadline time. So there's a link here for you to find your local support partner. So sometimes it can be a little bit of a minefield working out who would be most appropriate for you, especially if you've got locations all over England. But sort of pick one of those partners who's got you've got a site in their area, and we can work, either pass that to us as in the central team, or we can sort of work with you in region to get that sorted, because it might be that there's multiple providers across your patch. So that's one for us to figure out, but just get in touch with any of the support partners and it'll be directed to the most appropriate place. And finally, just to look at the wealth of resource that's out here. I mean, if you were going through sort of a different organizational, which was commercial, then these things come at a premium to get these sorts of templates. So some really handy resources which are up to speed with the standards that are expected within the DSPT. So there's no sort of worry there that they might not meet the correct threshold. So would really recommend looking into these documents if you haven't already got them in place. And we've seen in some instances that the DSPT may have been treated a little bit as a tick box exercise, maybe not aware quite of the background and the benefits of completing it in terms of making your organization more operationally resilient and ensuring that you have the preventative steps in place around cybersecurity and the ability to react to an incident or a data incident as well. So these documents and the tips that we've given you today that show you how to sort of relay that information to sites, but also to publish on behalf of groups of sites if it's more appropriate, will really help you to strengthen your organization. And we're more than happy to help with any of the sort of complexities around it and to make you even more operationally resilient. So there's also an additional sort of manager's discussion tool here. So this is really looking at how you're going to protect frontline staff and check their knowledge and provide some evidence of their competence, because we're mindful that sometimes the toolkit isn't something that is sort of relayed throughout the organization. So this is going to be really helpful to disseminate that process to ground level and ensure that you're realizing that maximum benefit from the DSPT self-assessment. So the tool is broken down into 4 color-coded sections. So this covers off 4 different learning outcomes. And this is for your frontline care staff. So the number 1 that we've got there is to understand the importance of data security and protection in the care system and your personal responsibility to handle data safely. So I think we always say, don't we, that the DSPT is about protecting the people that we care for, your staff and your organization, but important to emphasize that personal responsibility element as well to the staff in order to make that happen. Secondly, to be able to apply relevant data security and protection legislation and principles. So, one of the great features of the DSPT is meeting those standards and is updated on an annual basis to reflect increases in those standards, but also the threat environment to protect your organization. Number 3, to be aware of physical and digital threats to data security and how to avoid them. So this is including being alert to social engineering. So one of the threats that we see that's evolving in the cyberspace, especially with sort of the advent of AI. Number 2, to have that safe use of digital devices. So that there's a whole host of risks associated with that, especially for those of you that are mobile in the care that you deliver. And third and finally, safekeeping of physical records. So we know how important this is, and there's certain sort of timelines, for instance, that you've got to adhere to in terms of retention. So again, good to have that insight. And finally, it's being able to identify data breaches and incidents and know what to do if one happens. So there is the really useful report an incident tab on the DSPT toolkit, which is part of that functionality. so it can then be triaged, and you've got an audit trail to show that you've reported it within the time frame of sort of 72 hours. And again, there's a variety of support that can be offered. That's by the NHS Data Security Centre, but there's also other links that can be made to give you that sort of reactive response and to advise you how best to mitigate the threat, both in terms of damage to reputation, commercial, and most importantly, disruption to the users of your service, those in receipt of care. And finally, just to highlight not only intrinsically why the DSPT is so important in terms of giving your organisation alignment with those standards and more operational resilience, but also what it enables within the digital sphere. So I think we can see NHS Mail, for instance, there, is a really useful tool to connect across health and social care. There's some sort of looking at how that can be delivered differently in terms of a service as well at the moment. So it's an exciting time in NHS Mail. Also the proxy access to NHS records and GP Connect. So that's online. We've seen, I think, around 30% of care providers across England gaining access to this system, and the DSPT absolutely critical in terms of enabling that, not just because it's a prerequisite, but also ensuring that you have the right sort of systems in place and the right policies and procedures to use it safely. And then we've also, the main one really I'm going to highlight on there, we could be here all day if we went through all of them, but the digital social care records. So that the Digitising Social Care programme is live at the moment in terms of getting that grant funding, which varies across different areas in England, but a significant amount of money to support you with those first year implementation costs. Again, the DSPT is a prerequisite to that. So another more good incentives to do the DSPT beyond those intrinsic benefits of the product itself. I think we might have said the DSPT and insurance claims. So I think this is a point that's really worth making, that we are seeing in cyber insurance claims, I think 20 times contents insurance claims in this modern day. We were recently told by sort of the actuary network at our Home Care Association conference. So that really highlights the risk in this threat space. So the DSPT is a really useful tool. It won't automatically protect you when you fill it out, but if you take it seriously and you are careful to adhere to the standards within that and make sure that you access some support to help to get you to those standards, then that can lower the premiums and speed up the payouts if the worst does happen, because it gives you a really clear auditable framework that you can show someone so they understand the measures that you've put in place to mitigate those threats around cybersecurity. And again, you can make use of that viewer account that we alluded to earlier, myself and Katie, around how that can be used to inform staff of their obligations, but also it can be used for someone external if you're trying to spell out your arrangements that you've got in place. I just want to leave some time now for any questions. I think we might have one more poll.
Yeah, we haven't had any more questions come through, Tom, but yeah, I can launch the next poll.
Excellent. So yeah, if you could answer the poll on screen, that would be much appreciated. That's great. Well, thanks very much, everyone, for answering the poll. Really appreciated that. And again, if you do need to reach out, you know where we are. And thanks for your time.
Thank you.